Have you ever wanted to say something but can't find the words? Or you run into somebody and you can't remember their name? If you have been treated for cancer and are experiencing this, then you're all too familiar with chemo brain. I'm Catherine. Welcome to the Inspired Vitality Show. Let me know in the comments if you've been impacted by chemo brain. In this video, I'm going to give some validity to this very real condition and let those of you who are impacted know you are not alone. I consulted the top cancer centers and clinics in my research for this video, and I will also share my personal experience. The Mayo Clinic, MD Anderson Center, Dana-Farber, Cedars-Sinai, and the Cleveland Clinic all produce information about the validity of what is known as chemo brain. Chemo brain is a common term used by cancer patients to describe cognitive processing and memory problems. It can also be called chemo fog, cancer-related cognitive impairment, or cognitive dysfunction. Chemo brain refers to the cognitive impairment that can occur during and after cancer treatment. It's not limited to people who receive chemo, but it is more noticeable if you are having or have had chemotherapy. Surgery, radiation, and hormonal therapy appear to produce psychological reactions that potentially affect the brain as well. Many cases of chemo brain are temporary. However, other cases last for longer periods of time. Now, in general, factors that may increase the occurrence of chemo brain can include cancer of the brain, of course, cancer that spreads to the brain, high doses of chemotherapy or radiation, being diagnosed and treated at a younger age, menopause, and aging. The symptoms are varied and many and can include confusion, concentration difficulties, word recall difficulties, lack of mental clarity, decreased attention span, requiring more time to finish routine tasks, difficulty with visual or verbal memory, lack of remembering names, dates, and everyday things, and difficulty doing more than one thing at a time. All of these symptoms create challenges in the patient's personal and professional life. According to the Mayo Clinic, the severity and duration of the symptoms, sometimes described as chemo brain, differ from person to person. Most cancer survivors will return to work, but some will find tasks take extra concentration or time. Others may be unable to return to work. The nonprofit organization Cancer and Careers has a great article about working with chemo brain, and I'm going to link to it in the video description. I think it's really important to differentiate chemo brain from other conditions such as dementia, Alzheimer's disease, or simply forgetfulness. Now, according to the Cedars-Sinai Medical Center, during cancer treatment, patients usually experience increased stress, changes in their sleep and diet, as well as a variety of medications to help with nausea and pain. Any of these factors could influence cognitive performance. Dr. Asher of the Cedars-Sinai Medical Center says, for all the mystery surrounding this condition, there is one thing we do know for certain. He says chemo brain is not dementia, and there is no evidence that it leads to dementia. According to Dana-Farber Institute, in Alzheimer's, memory doesn't respond to cues, whereas chemo brain cues are helpful. So, for example, in their article, it is noted that if a person was asked to remember yellow and asked what it was a few minutes later, a clue such as it was a color would be helpful for somebody with chemo brain, but not for people with Alzheimer's. Other types of dementia usually involve personality changes and motor changes such as stiffness or tremors or hallucinations, which are not typical of chemo brain. However, it can be hard to differentiate chemo brain from age-related forgetfulness when symptoms are mild. The Dana-Farber Institute said that in one large study, breast cancer survivors who received chemotherapy actually had a lower risk of Alzheimer's and other dementias compared to those who did not receive chemotherapy. In general, experts recommend that physical and cognitive exercises can help lower stress and increase alertness. Also, they recommend foods that are rich in healthy fats and anti-inflammatory nutrients because they may enhance brain health. The MD Anderson Center dives deeper with their 5 coping strategies to minimize the effects of chemobrain and says, first of all, exercise. Even 5 minutes of mild to moderate activity may improve mental function. Second, they said use memory aids. Using a notebook, a planner, or a list, or electronic device to keep track of things, or even a small recorder can come in handy. Third, treat fatigue and sleep problems. These conditions can worsen chemobrain symptoms. Fourth, manage depression and anxiety. Easing stress and elevating mood can ease chemobrain symptoms. And lastly, minimize distractions. Employers are required by the Americans with Disabilities Act to make reasonable accommodations for health-related issues such as chemobrain. A more soundproof environment, like an office or a cubicle in a different location, can decrease distractions and improve concentration in the workplace. After my chemo ended, I noticed I was really struggling with cognition. So during radiation, I began carrying a puzzle book with me to all of my appointments. I wish I had done that sooner. So do as I say, not as I did. Start those puzzles as early on as possible. Then, 2 years after my treatment, I returned to school and I studied with the Institute for Integrative Nutrition. I like to say that it was both really hard and really good for me. The coursework was online, and at first I had to replay videos over and over to comprehend all of the content. I found that turning on the closed captionings was helpful, and that reading and listening at the same time helped me to absorb the information better. Sleep is a huge factor for me. Even to this day, 6 years later, if I do not get 7 to 8 hours of sleep, my cognition function is greatly reduced. I've become a master at using lists and technology to remember things and tasks that need to be done. When I really need to concentrate, I'll put on headphones with calming background for noise. For me, rain sounds work well to help block out other distractions. Even if you can attribute any symptoms you're having to chemobrain, you want to be sure you've addressed medical concerns. It's a good idea to have your thyroid, vitamin D, and B12 levels checked. And if you experience any depression, anxiety, or sleep problems, such as sleep apnea, make sure you seek treatment. If you notice severe memory or concentration problems that make it difficult for you to do your job, tell your doctor. You may be referred to an occupational therapist or a neurologist who can help you adjust to your current job or identify your strengths so that you may find a new job. Additionally, if you have any other neurological symptoms, such as headaches, new balance problems, or weakness or numbness in any body part, it's very important to ask your oncologist about an MRI. To my fellow cancer patients, we may joke or make light of our chemobrains at times, but we know this is a very real thing to manage. I hope you've picked up a helpful nugget of information, or maybe two. If you have, please do me a favor and share this with another cancer patient to let them know they are not alone. I've got all my references in the video description, so check them out, and I'll see you soon.